So most of us in the Caribbean, we know someone, or we ourselves know someone who has type 2 diabetes. It's a lifestyle disease. If you are overweight or obese, you have a higher risk of having type 2 diabetes. If you have a sedentary lifestyle, if your diet is high in carbohydrates, I know from Barbados, we love our salt bread, our sweet bread, our dumplings, our bakes. All over the Caribbean, we eat all of this stuff that are just full of flour, right? And they're going to raise our blood sugars and put us at risk for having type 2 diabetes. If you have a family history of type 2 diabetes, you are also at risk for getting it. If you have one parent who has type 2 diabetes, your risk is about 25%. If you have two parents who have type 2 diabetes, your risk goes up to about 50%. That's a 1 in 2 chance of getting diabetes. The older you are, that's also another risk factor. Patients over the age of 40 to 45, your risk of having diabetes also increases. And you can also have pre-diabetes as well. Pre-diabetes, your blood sugars are not normal, but they're not quite yet in the diabetes range. In America, 88 million people have pre-diabetes. A lot of us don't even know that we have a blood sugar problem. So this really affects the Caribbean. I did my medical school, and I also did my 2 years residency in Barbados. And I remember being on the surgical rotation, and half of the people who were on that floor, on that ward in surgery, half of them had an amputation. So even the complications of diabetes really affects us in the Caribbean.